and I always have a backup video recording just in case. So here we go. Oh, stop recording. Start. Okay, I think I'm starting. Okay. All right, good morning and welcome back to another Somayoga practice. So this morning we're going to be working, continuing on with a little bit of the core theme, and we're going to be working towards hips to feet. So for props, we're going to need a blanket or, usually 1 or 2 blankets we usually have, a massage ball. If you have a stretch loop, we will be perhaps using that. It's an option. You might like to use a stretch band as well, and always have a cushion for your head. And depending on where you are in the space that you're working today, if you happen to have a coin or a loonie, or a coin, a quarter or a loonie, we're going to be doing a little trick with our arches of our feet. So I just have to adjust one thing on my screen here, and then I will be right back to you. See if this makes things differently. Doesn't change much. Okay. All right, so we're going to start off on our back. So coming down, making your, and the last option would be a chair, which is for some standing work if you need it. So, all right, otherwise we're going to make our way down onto our back. And we're just going to find our effortless rest position with the feet on the floor, knees bent, using any props that you need, obviously, underneath you, whether you need a blanket. And then just take a moment to let yourself settle into the floor, feeling and sensing the curves of your spine. How do you meet the floor this morning? Perhaps checking in with the weight of the pelvis from left to right. Noticing the weight of the shoulders from left to right as well. And then with the arms, again, they extend out from the shoulders, so noticing how the position of your shoulders might have an impact on the arms. And then also into the feet or the legs, noticing if there's any depth, sensation of difference, or sensation, period, around the differences between the right or the left leg. So we're again going to go through the 6 directions of the pelvis this morning. So thinking about the structure of the pelvis, that arch and flatten movement. Let's go into the flatten today first. So we're going to think about rolling the pubic bone towards the navel, and the rib cage starts to roll down or pull down towards the pubic bone, pressing your lower back into the floor. And again, you might notice there's that little bit of an arch in the back of the neck because of the weight of the head. And then you're sensing and feeling that contraction in the abdominals, slowly letting it release, finding your neutral position, and then maybe tying that into your breath as well. So exhale as you come into your flatten, inhale as you release, and then try it one more time. And then pause in your center, and then on the next inhale, you take your tailbone towards the mat. You might think about pressing the head gently to the mat, feeling that arch in the low back, and then exhale as you release the pelvis, the back muscles relax. And then again on an inhale, taking the tailbone towards the mat, and a gentle press of the head into the mat. And slowly exhaling. And then maybe one more arch, finding that range that's available this morning, and slowly letting it release. And then we play with that arch and flatten, alternating between your arch and your flatten. So it's your choice if you want to go completely from one movement directly to the next, or if you want to take that subtle pause in the middle. Remember, when we're looking at the re-education piece, those pauses can be very beneficial. So you might wait for your breath cycle before you go into the opposite direction movement. But if you feel that doesn't work for you, then you take your movement all the way from one direction into the complete opposite direction. But I still encourage you to go slowly and paying attention to the sensation and where you feel contraction, efforting. And using this as a bit of a tool of assessment of how your spine is moving this morning. Where there might be little areas of stuckiness or stickiness or overactivity. And then once we're complete with a few repetitions, we're going to let that go. And then let's bring the hands onto the sides of the pelvis. So we're going to go through our hip hikes here, lying on our back. So we're going to take the pelvis on one side. So I'm going to start on my right side, bringing the pelvis towards the rib cage, hiking that hip towards the ribs, staying level on the floor, and then allowing the waist to lengthen again. And kind of stay on that one side for maybe 2 or 3 repetitions, going into that contraction and then slowly letting it release. And again, you can play with your breath with these as well, so you could always exhale as you go into that shortening contraction and inhale as you open it up. And then once you've explored a few of those directions, then we go in the opposite direction to the other side. So I'm going now to my left, shortening the waist on the left, and then slowly letting it release. And then again, repeating it a couple of times. And then alternating back and forth. So again, you might choose to exhale, taking it into the shortening contraction, inhale to the center, and then again exhale to the opposite side. Inhaling to center, and then exhaling again to the other side. So again, now we're alternating from side to side. And then once you've completed with that, we'll let that rest. And then we look at taking the pelvis into rotation. So that's with our hip lift and our hip dip. So we think about relationships here, or I think about relationships here between the right front and the left low back, to take my right side of the pelvis towards the sky and the left side of the pelvis towards the floor. So there's they're both working in contraction to do that movement, and then we let it release. And again, stick with that same side that you're working with and see if you can sense that there's as much effort on the front of the body as maybe on the back of the body in this one. I think it was last week that I broke them down into front and back, but they work together to rotate the torso or the pelvis. And again, you could exhale on your effort. And if we think about that whole core connection, when you exhale on your effort, you're going to be tying into your pelvic floor and your transverse abdominis as those obliques and your lower back muscles start to tie into that rotation. And then practicing a few on the other side. So now you're focusing on the left lower abdominals here, those lower obliques, and then the right low back to find that rotation of a left hip lift and a right hip dip. Slowly releasing. So again, you might effort on your exhale and inhale as you release. And once you've again explored maybe 2 or 3 of those, then we'll alternate from side to side. So right hip lift, left hip dip, come back, let everything settle back to center, and then going in the opposite direction. Right hip dip, left hip lift. And it's always curious if one direction is easier for you. And the one that is easier usually tends to be your pattern. So the one that's harder is the one that we might have to work, try to come back to and try to do it a little more often to see if we can re-educate the opposite pattern to start to balance out the stronger pattern, is how I kind of think of it anyway. All right, so once we've played here with the pelvis in all those different directions, then just take it through your arch and flatten again, and noticing if there's any sensation difference in the mobility or the sense of ease, if the tissue is a little more supple in those ranges of motion. And then from here we're going to start to explore with the legs. So those 6 directions of the pelvis are the directions that the pelvis can move off the spine, but there's times where we want the pelvis not to be moving off the spine, which might be when we're loading our legs a little bit. So they're going to lengthen the right leg down to the floor, moving through our internal and external rotation of that thigh while we maintain the pelvis level. So starting to roll your thigh out and then roll the thigh in. So we want to feel this leg bone moving in the hip socket while the pelvis stays level. Rotating 2 or 3 times in each direction. So I'm going actually all the way from external to internal this morning. I'm not breaking those movements down, but if that feels necessary for you to break it down into external, maybe a couple of times, and then internal, rather than going right through the whole movement. Remember that this is a hip movement. Oftentimes we'll get a little overzealous with the knee or the foot, trying to lead that movement. So that's our internal and external rotation. And then go ahead and bring your right knee bent into a bent position again. And then we're going to play with our knee drops, which is, it's not exactly internal and external rotation, and this is more of a what we call an abduction movement and an adduction movement, where you then bring the leg back in. So if we're unstable in the pelvis, what can happen is the opposite leg might scoot out as you lower the right leg. You might notice your left leg moves out slightly to stabilize your pelvis. So make sure that that left leg is staying quiet as we let the right leg move out towards the side. Now, we talked about that core breath work last week, so you could use your core contraction here as you exhale and let the right knee drop out towards the side. That's going to assist that stability in the pelvis. And then you can bring the leg back in, either on an exhale or an inhale. And then play with that right knee drop. Let the foot come away from the floor, so as the leg goes out, the inside edge of the foot will come away from the floor slightly. And then as your leg goes towards the opposite side, the outers are towards the left, the opposite side of the foot is going to come away from the floor. Okay, so then go ahead and rest there, lengthen your left leg down to the mat, and we'll explore that internal and external rotation of the left leg. So thinking about rolling from that hip socket, the thigh rolls out and then it rolls in, and repeating that movement back and forth. Again, if you want to break them down into their individual movements, you can play with it that way as well. So turning the toes out to the left, just coming back to center, and then going left again. Or you could go all the way from the left, letting the toes turn to the right. And then again, I reference the toes, but it's the movement in the hip. Okay, so maybe one or two more. Feeling that the pelvis is staying level as we rotate. And then bending your knee, bringing the foot to the floor again, and exploring your knee drops here on the left side. So we want to allow that leg to drop out to the left without the pelvis rolling into that hip dip or a hip lift on the right. Watching that your right leg doesn't scoot out to counterbalance, and then bringing the leg back up and bringing it in. You can try adding that core contraction as you exhale, engage your core as you let the knee drop out to the side. And then you can inhale the leg back in, or you can inhale with the leg out there, and then exhale as you bring the leg in. And third option, there's always options that you could just sustain that contraction in your core as you move the leg in and out. And when we add on to this a little bit, that sustained contraction might make more sense. Okay. And then once you're complete with that, we're going to work on loading our hip flexors a little bit here. So when we take the leg long, our hip flexor is in a lengthened position. When we bring the knee into a bent position, we've shortened our hip flexor a little bit, and then adding load onto the hip flexor. When we bring the knee towards the belly, I want you to bring your right hand, so I'm working on my right thigh, bring your right hand down to your right thigh, and then keeping your spine in neutral the whole time from the foot coming off the floor to your hand to your thigh. Then push your knee into your hand and your hand into your knee. And then you're going to sustain that pressure for maybe the count of 5, 4, 3, 2, 1, and bring the foot down. Bring your left knee in and your left arm, and you're pressing your left hand into your left thigh into your left hand. 5, 4, 3, 2, and 1. Bring the left foot to the floor. Right knee comes in, right hand onto the thigh, and again you're pressing 1, 2, 3, 4, 5. So your pelvis should be staying level. And as you're pressing with the hand and the arm pressing into each other, you might start to sense some activation through your core, through your abdominal muscles. And we'll repeat that a few more times. So you maybe getting that sense of sustaining that contraction through that count of 5, 4, 3, 2, 1. So this is the first level of sort of loading the hip flexor. And then we're going to look at a different one. Finish off with the last one on your left. So the next one, when we're loading the hip flexor, we're going to take the leg long all the way towards the end of the mat. The idea is to keep your pelvis, your rib cage in neutral, so we're not rotating it all through the trunk. And you're going to be lifting the right leg away from the floor. So you're going to lift it away from the floor, and then you're going to externally rotate the thigh, so your toes turn. I'm going to take my sock off because there's a black chair behind my black sock. So you take your foot away from the floor, rotate so your toes point out, and then you take your leg out towards the right. So this is taking all of those movements we just played with, but what we don't want to happen is the pelvis roll away from the floor. So we again have to likely sustain the contraction in your core. So taking it back to the beginning, leg is extended. Exhale and engage your core as you lift your leg and you take it out to the side. And we're going to hold there for 5, 4, 3, 2, 1, and then bring it back in. Okay, so I want you breathing while you're doing that, so you're not just holding your breath while you're sustaining that contraction. So you exhale and engage your core as you lift and you take it out. And you might need to take an inhale here. You can breathe 5, 4, 3, 2, 1, bringing it back in and down. Okay, so keep going here. We go lifting it up, out to the side, 5, 4, 3, 2, 1, and come back. Watch that the pelvis is staying level. We'll keep going. 2, 1, bringing it down. Exhale as you lift it up, and 5, 4, 3, 2, 1, and down. We'll do a few more. 5, 4, 3, 2, 1. Bringing the leg back in and down. And maybe one more here. 5, 4, 3, 2, 1. Bring that leg in and lower it down. All right. And then so if you find that you really can't keep your pelvis level, then you might be more prone to play with this one where you're first just starting to load that hip flexor in a neutral position rather than adding the full load of the leg. The leg is obviously a longer lever on the core, okay, or on the trunk. So again, you're going to lift as you exhale. Rotate the toes of the left foot out towards the side. You're lifting the leg up and taking it out and over towards coming away from the midline. And 5, 4, 3, 2, 1, and bring it back in. And then again, exhale and engage as you sustain that contraction. 5, 4, 3, 2, 1, and bringing it back. Repeating it. We'll go for, I think we did about 6 or 7 on the other side. 5, 4, 3, 2, 1, and bringing it down. Exhale, engage as you take the leg up and take it away from midline, keeping your pelvis level. 3, 2, 1, bring it down. 5, 4, 3, 2, 1. And 5, 4, 3, rotating, externally rotating, and taking the leg off center. 1, 2, 3, 4, 5, and then bringing it back in and down, and then bending that knee, and then maybe just taking a little twist from side to side as we've been on our back for a little bit. And then we're going to roll over onto our side. So when we come onto our side, we've all done a lot of these lateral hip strengtheners. It's one of my favorites. So if you choose to, you could use a stretch band on your thighs. So if you do use a stretch band, and take it up to about mid-thigh, or just above the knees, so that you have a little bit of resistance if you choose to add that. Have a cushion for your head, and again, I always like to have a blanket under my ribs so that I can stack my shoulders, and letting yourself come down into that sideline position. So for this one, we're working with the ankles or the heels in line with your sit bones, so your knees aren't at that straight back chair position. Your stacked hips, ankles, and knees. And then we're inviting the core into this if we need to. You're going to just lift and lower the leg. We're coming up. 1. You want to watch that your pelvis isn't rolling back. So again, you're going to exhale as you lift and inhale as you lower down. Watching that your knee and your ankle, try to see if you can sense them coming up about the same rate of speed so that the ankle and or the knee aren't higher than each other. Trust me, we're going to be targeting those other angles, so we want to not fatigue them too much. We're going to shoot for 10. 7, 8, 9, and 10. And then let the leg lower down. Okay, so that's your lowest load. We can choose to stay there, or you can lengthen the leg down towards the end of the mat. So coming with a straight leg, and I think I like to flex my foot rather than just leaving it kind of hanging down there. So we're going to lift again. You're going to exhale, lifting up, watching that we aren't hiking the hip. So you want to maybe keeping your hand on the top of your hip so that you know that you're moving from your hip socket. Exhale as you take it up. Inhale as you come down. Watching that your pelvis isn't rolling back or hiking. And then that's the last one. Let yourself take a break there. If you need to massage up the side of the hip, take that moment here to do that. We're going to go into a different position. This one is going to target a little bit more towards the front of your hip. What we call our TFL. So you're going to put your leg in, if you're doing the lowest load position, we're putting our leg more in that not a reverse clamshell position. So this also is the addition of the hip hike when we're doing somatics in our side curl. What I don't want you to do today is actually hike your hip. So we want to move that leg only as far as we don't feel the hip hike. And so that ankle is lifted away from the ankle, bottom ankle, and then we lift the leg again. So 1, keeping your leg in that rotated position. So your thigh is in an internal rotation as we lift and lower. Again, watching your pelvis doesn't shift or rotate back. again, that's our lower load position, and you could stay there for your second set if you like, or if you want to join me, hopefully I can do this on this one. We extend the leg. It's kicking your foot forward and then internally rotating, so your toes are facing the floor or towards the floor as you lift and lower your leg. So again, no hiking and no rotating back. Whew. 9 and 10, and then letting that leg rest again. I need to tap out after that one. All right, so the third position, because our leg moves in all those different rotations, internal and external, we're going to do our clamshell here. So we're taking the leg though into the clamshell position. So we want to make sure that we're keeping our pelvis in neutral and we're not rolling the pelvis back. And then we're lifting the leg, keeping your leg externally rotated. It's going to target a little bit further back into the hip, the back side of the hip. 5, we're going to try for 10, 6, 7, watch your pelvis, 8, as we fatigue, that's when the we'll lose that form. Ugh, okay, that's a hard one, especially after all these. Okay, so the last one, we're going to be doing it with our leg extended if you choose to go there. So you lengthen the leg down, but we're bringing your heel back towards the back edge of your mat, but going only so far as you don't arch your back. Now you're going to try to externally rotate that thigh without rolling your pelvis back, and then we lift from here. 1, 2, 3, 4. Your core engages. Watch the hip isn't hiking. It's all from the lower, from the hip to the foot. And finally, I think that was 10, and release that leg. You could bring it in for a little hip stretch there. Tapping it out. And then from here, we'll go over onto our back and just do a little hip release work before we go on to the other side. So once you go on your back, you might take the props out and maybe bringing the left ankle onto your thigh. If that's not comfortable, just bring that left knee in, and you could even ditch your thigh band if you're wearing that. Either way, we're hanging out here in either your knee to the belly. You might be even taking your leg out to the side and bringing it back, just moving your hip around. And if you're comfortable with the ankle to knee position and you want to get a stretch in there, you could bring your right knee towards your belly, watching that your pelvis is staying neutral here, and taking a few breaths. And just lengthen that left leg out and roll it back and forth into your internal and external rotation a few times, just really kind of letting it relax, shaking it out. Okay. And then maybe twist again from side to side. That always gets that outer hip when we let the legs rotate. And then we're going to switch it over to the other side. So if you do want your loop around your legs, you're welcome to use it, or if you want to ditch that loop, go ahead, it's up to you. And I'm just going to flip over here. Not sure how I actually just had my vaccine shot yesterday, so I'm not sure how lying on this left arm is going to be. I don't think it should be too bad. No, it's good. All right. So we start off, we want to think about the angles here. So the heels are about in line with your sit bones, knees are bent, and we want to watch that we're keeping the hip in a neutral position, and then we're going to be lifting the thigh. So this is your first lowest load position. We're lifting and lowering, engaging the core as you lift up, inhaling as you come down. Watch the ankle and knee. Stay about the same height. I think that was 10. So that's your low load. Then we go to the higher load, or you stay with the low load. So the higher load, you take your leg, down to the end of the mat. And you can have the foot flexed. We're in sort of the same alignment here, hip to ankle. We lift and we lower, watching that your pelvis isn't coming up. So it's a true hip movement. Take that pause between each of these different positions, tap out that hip if you need it. And then the low load here for the more towards the front of your hip is to internally rotate the thigh, so the ankle lifts but without adding that hip hike. And then we lift the leg. So try to keep your thigh in the same position as you lift and lower. In the same position as in internal rotation. So we're not letting it return back to neutral. We're just lifting it. I think that's 4, 5, 6, 7, 8, 9, and 10. Okay, and that's your lower load, and then the higher load will be with the leg in an extended position again. So we extend it, we kick it forward, we rotate so the toes are turning towards the floor, and we lift. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Oh my goodness. You'll be thanking me for these. All right, and then the lower load of the externally rotated hip is going to be like our clamshell movement. So we lift the thigh away from the bottom thigh. So you've externally rotated, watching your pelvis has it rolled back. And then we lift away. So you're lifting your foot away by lifting at your thigh, not rolling your hip back. 3, 4, 5, 6, 7, 8, 9, and 10. Whew. Okay, and then we let that go. Tap that out. That's the lowest. Oh my gosh, that's the lowest load. We've got to go to the next level. All right, so the higher load, if you choose to go there, if you find that that's the load where you want to stay, that's where you stay. So what's more important is that you're able to maintain the position of the torso without like bracing through the upper body and clenching and gripping. So we're going to take that leg long towards the end of the mat. Now you take your leg back without arching your pelvis, so your spine's in neutral. You rotate so your toes turn towards the sky, and then we lift and lower. 2, 3, 4, connecting to your core. 5, 6, 7, 8, 9, and 10. Woo, okay. And then again, from there, we'll roll it on over to your back. And you can ditch that stretch band now. So your choices for working with the hip, you could be taking it long, just rolling it into that internal and external rotation. You could bring your knee towards your belly, moving your leg out towards the right and the left, or you could choose the ankle to knee, where we bring the right ankle onto the left thigh and then bring your left knee towards your belly and hang out for a few breaths. And then releasing from that, and again, you can take your legs out to the sides, or into a twist from side to side a couple of times. So from there, let's just take a moment to roll back over onto your left side. You don't need props necessarily. Maybe just taking your arm up to support your head, but if you do have your cushion there, you could use it. Let's give our hip flexor and our quad a little stretch here. So you could use your stretch loop here, or a stretch band. If you can't reach the ankle, you could loop that band on your foot. And then we're going to take our ankle. So we want to try to be on the ankle rather than just on the foot. And you can keeping your pelvis in neutral here again, we're going to start to pull the thigh back and opening up the front of that hip with the knee towards the end of the mat. Watch that your leg hasn't come up towards the sky either, so have a peek down. We want the thigh to be still fairly parallel to the floor, opening up that hip. And then just take that to the other side. So you can just roll over or flip over. And again, ankle comes towards, or heel towards your bum. Try to get a hold of that ankle. And then your pelvis is in neutral here again as we take that foot and pull it towards the bum. Your thigh will move back. And then just opening up the front of the hip again. And then from there, we're going to make our way up onto our feet. So in whatever fashion you come up, make your way up onto your feet. And I probably am disappearing on my screen. I don't know, maybe you can see part of my head, I don't know. Maybe what I'll do is just angle it up a little bit, because I am going to do a little bit of work with shoulders too. So there we go. But hopefully my feet don't completely disappear. Okay, so we're going to use our massage ball here. We're going to roll out our feet. So before we do the actual rolling though, come to find your Tadasana. Taking this moment to just check in here. Feeling how you're bearing weight through the feet. Hopefully you have some awareness of that you've used your hips a little bit this morning and all those muscles around the hips. So we're going to take the ball under that right foot. So you could have the heel on the floor and your right foot stepped forward a little bit. And then just starting to roll the ball across the ball of the foot. Three or four passes across the ball of the foot. So think about trying to manipulate each of the long bones of the foot here. And then we take the ball and bring it back a little bit towards you so that you can have your legs stacked under your hips or your feet stacked under your hips. Bring the ball back just behind the ball of the foot and then let your foot drape over the ball. And then while we're working with our feet, we'll just come back up to our shoulders as well. Roll them out, bringing them up towards your ears, exhaling them back and down. Watching that this is a shoulder and arm that are moving. The rib cage and the spine are generally staying quiet here. And then we're going to take that right foot and roll the ball so that your foot comes forward a little bit. You might still have your heel on the floor and then inch your left foot forward. From there, taking your arms out to your sides, we're going to just internally and externally rotate the arms. So think about the elbow pits maybe a little bit more than the palms, watching that you're not drawing the shoulders forward. It's just those arms moving in the sockets. And then once we've done, well, we've done about 6 or 10 of those, then roll the foot forward. The ball of the foot comes to the floor. Step your left foot forward and connecting to the heel. So you might have that right knee bent. So again, we keep our pelvis level. If it's available to you, take your arms out to your sides, and then we're going to take the arms back, opening the chest, maybe flexing the wrists so that you're pulling your fingertips back. And letting the ball come forward again. So the ball of the foot's on the floor. We have the ball under your heel. Your right knee will be bent. Your pelvis is level. Taking your arms out to your sides. Roll the palms up to the sky. And then cross your right arm under your left. You could either bring your hands onto your shoulders here, or you might choose to come into the eagle arms position where the back of the hands or the palms come together. And so you're going to get a stretch through the outer sides of the shoulders maybe into your upper back. And then releasing and taking the foot off of the ball. And then just coming back to your Tadasana and getting that sense of the foot on the floor, how rolling it out might have changed that. And then we'll go to the left side. So you're going to take the ball out in front of you a little bit, left heel on the floor, right base of the big toe on the ball, and then you're rolling that ball back and forth underneath that left foot. So again, we're going through those movements of internal and external rotation in your hip. So your pelvis is generally staying still, so I'm not rotating my pelvis, I'm just rotating that leg. And then once we've come back to a static position and a static hold, we'll go back up to our shoulders. So the ball comes underneath the left foot, and it's just behind the ball of the foot. Your heel's likely on the floor, and then this time we take the arms out to the sides. Palms roll again up towards the sky, bringing your left arm under the right this time. And then again, you might have your hands on your shoulders. You may bring the back of the hands together or bring the palms towards each other. And then again, just taking a few breaths here. And then releasing the arms, bringing the ball a little further forward on your foot so your heel could still be on the floor here. And then take your arms out to your sides. This time I'm just going to pull your elbows back and hold that there, so we're opening through the heart. And then releasing your arms, taking the ball a little further down your foot so the ball of the foot maybe comes to the floor and inch your right foot forward again. And that left knee will be bent now. If it's available here, you can take your arms out to your sides. We roll them in the socket so the palms face the wall or the back of your mat. Take your arms back again, and if it's available to clasp the hands into a fist, bring the hands into a fist. Again, taking the hands maybe towards the floor, opening through the heart. And depending on how you feel here, if you feel comfortable adding a little bit of a back bend into this, you can. Notice that you're a little bit maybe unsteady on your feet with one foot like it's in a high-heeled shoe. And then releasing, coming back to center. And then take that ball under the heel. Again, maybe the ball of the foot's on the floor, stepping forward. And then from there, take your arms out in front of you. Clasp your hands into, just clasp, interlacing your fingers. Rotate your palms so they face away from you. And then see if you can bring your arms in the direction of coming up and over your head. As you come up and over your head, we want to try to pay attention to not arching your back. So we're just coming up through what we call that shoulder flexion. And then releasing your arms, letting them come down and releasing that ball. And then just come back onto your feet, balancing on both feet. And just take a moment again and check in with the sensation of the foot on the floor. Pay really particular attention to the inside arch of the foot and the big toe mound, because that's where we're going next. So if you did have a coin in your space, if you don't have one and you're watching the recording, you can go and grab one. But just imagine what it would be like to have a coin under your foot. So this is actually called pen and penny, the exercise, but it's hard to see what's going to be happening with my foot and the pen with this distance, and I don't feel it playing with camera angles here. So we're going to take that loonie or coin under the ball of your right foot, and if you don't have one, just imagine that you've got something under that foot. So you can probably see when I load weight through my right foot, my arch here kind of sort of disappears into the mat. So this exercise is going to help me to try to strengthen that arch. So what I'm going to try to do with the pen, what I would have is a pen stuck under my arch, and I'm trying to let that pen level out. But without it, what I'm going to try to do is think about dragging that coin with the big toe mound down towards the heel. So you can probably see how my arch right here comes up away from the floor. So you can see it creates a little more space there, and then letting that go. So what we want to try not to do is curl the toes in completely, because that doesn't really lift my arch at all. It does slightly, but not very much. Not as much as if I think about pulling the big toe mound towards my heel and then letting it relax. And then we pull. And then there's another way that we can also work this foot, and that's going to be trying to bring the heel towards the coin. So whichever one seems to make more sense to you, that's going to work the sole of the foot, lifting, and it's going to contract the arch of the foot and and then you relax it. So the heel could come towards the foot, or the ball of the foot could come towards the heel. Either way, okay? So, and then again, we take a moment and just sense and feel how that, and the other thing is I haven't had a pedicure in a long time, so bringing the camera angle down to my feet as I look at my toes, they don't look very nice anymore. All right, so let's try that on the other side. So if you don't have a coin, just imagine having a coin there. And again, if I load through that foot, I'm pretty much losing that arch. So I want to work on strengthening it. So we want to try to bring the big toe towards the heel to lift the arch of that foot, and then lower that down. Imagine if I did this every day, maybe I'd change a shoe size even. I don't know, because it does shorten your foot up a little bit as your arch comes away from the floor. And you might even notice, if you do this, maybe balancing your weight a little bit more through both feet, that you might notice as you pull the arch of the foot, you might feel there's a relationship to that outer hip that we just worked on. You might be able to sense that, and you might not. And then again, you can try pulling the big toe mound towards the heel, or you can play with trying to pull the heel, and I can't do that as well on this side, which is curious. I want to just really dig into my toes here to pull the heel towards the ball of the foot. So definitely have more control over that right foot than I do this left one. Okay. All right, so that's the pen and penny trick. And then we're gonna just play with a little functional or yoga movement here. So you might like to have your chair for this one. So I wanted to explore two movements here. One of them is with a stable pelvis and moving the leg into external rotation, which is like our tree pose. So if we shift our weight into, I'm going to go into my left foot first. We're going to have to do that little tiny list. Flex the thigh so it's coming up. You're going to rotate it out so that the thigh turns out into that external rotation, the knee turns out, and then you place your foot on your thigh. So that's our tree. So you could stay here, or if it's available for you to bring your right ankle onto your left thigh with your pelvis not going off in any of those 6 directions of the pelvis, then you could bring the ankle onto the knee, and we can come into a little bit of a, this is why we need a wall or a chair when we lose our balance. So then you can come into a bit of a squat position. So if you're doing the squat position, what we want to be aware of is that we haven't collapsed the left leg, so the knee is still stacking over the ankle and hip. It's not gone into that falling in, it's called valgus position. So we want to think, and it's going to work that outer hip as we find balance pose in our, it's called standing pigeon, and or you might be in your tree pose. Okay, so that's our balance. We're working on hip to foot stability, which ties in to our whole core stability system. We fan out through the hips down to the feet. All right, so that's our tree on that left leg. Now we're going to try that on the right. So either tree or standing pigeon. So again, we want to find that when we list, we're not popping that hip out, so we're staying stacked. And again, you can flex the knee, pelvis stays in neutral here. You rotate the thigh out towards the side, find your foot placement, or again, if it's available for you to take, the thigh into that rotation and bring the ankle above the knee without the pelvis moving in a hip hike or a rotation, or arch and flatten. Then we can come into that hinge and a little bit of a squat here, trying to keep the pelvis level. So even you might be able to bring it to this position, but then when we add the squat, we might find that we rotate. So we want to try to find that ease. And so I notice this more on this foot when I'm trying to find that balance. That pen and penny trick that I just did is where I'm trying to find my stability in my foot, my arch, and sort of bringing that big toe mound towards the heel to offer my whole torso or my whole body some stability here. So again, we've got to try to relax the upper body as we're doing an efforting pose in the legs. And then coming on out of that and give your legs a shake. So that is all moving the leg bone in the hip socket. Then we're going to explore with our Warrior 3 movement, where we're then moving the pelvis on the stable leg. So we're going to go back. This is where you again might need a chair. So we're going to go back to our Warrior 3 work. So again, we're going to come to shift weight into our left leg, taking your right leg back into hip extension, still neutral position in the pelvis as we hinge forward over the left leg. So in my, all I can relate to is what I'm feeling in my body. If I were to keep going into this fold, either my knee is going to collapse or I'm going to lose the rotation in my pelvis, or I'm going to rotate in my pelvis. So I'm going to stay here. I'm even going to deload my pose a little bit by bringing my hands onto the chair, which is still allowing me to work my hip muscles, but I'm able to relax my body a little bit more by just bringing my hands onto the chair. So the upper body doesn't have to be bracing and gripping quite so much. So then, of course, you can play with the arabesque of your hip here by rotating your pelvis on that stable leg, which is going to bring your thigh into the position of external rotation as we rotate the pelvis to the right. Or if we drop the pelvis to the left, our thigh is going to be into that little bit more adducted position and slight internal rotation. And then we're going to come back to center and bring that right foot onto the floor. And then we'll try it along the opposite side. So you're going to shift some weight into that right leg. From that Tadasana, we take our left leg back into hip extension, and then we hinge forward over the right thigh. And again, you can feel free to take your hands onto the chair to deload a little bit of the torso and the pose, where you can still do the work, but maybe in a little more ease. And then once you've found that, again, you can play with the rotation of the pelvis moving on that stable leg. So you can drop your left hip down, find neutral, and then rotate the left side up. So, and when I do this, when I think about moving the ribs and the pelvis together rather than trying to find that rotation through the waist, I want this rotation to happen on the axis of that top leg, or on this right femur. All right. And then from there, find your Tadasana again. So we've, actually you might like to use your chair here for this last one. So we're just gonna go into down dog here before we come down to the floor. So if you like to do down dog on the floor, you can do it that way. I'm not gonna load through my shoulder because of the vaccine shot there yesterday. My arm's a little bit sore. So feet step back to a comfortable distance. Then you draw your hips back towards your heels, finding that downward dog, lengthening through the back of the legs. Taking some rest breaths here. And then making our way down to the floor and either choosing child's pose or coming onto your back to bring your knees in towards your belly, whichever serves you better for knee, ankle, low back issues, whatever serves you the best. So coming in, you're going to get a little bit of a low back stretch. So knees to the belly. You might, if you're on your back, bring your nose up towards your knees. You might rock from side to side in either position, rolling the hips back and forth on the lower legs if you're in child's pose, or rolling on your back. And then from there, we'll make our way over onto our back. So just before going into Shavasana, we're going to come into effortless rest again with your feet on the floor and knees bent, the position that we started out in this morning. And once you get down into that position, just take a moment to go through those arch and flattens one more time. So maybe 2 or 3 repetitions. And again, sort of exploring that in terms of an assessment of how things are moving after working with pelvis and hip stability and connecting down to the feet. And once you've done your arch and flattens, go into your lateral hip hikes. So those hip where we're shortening the waist on one side and lengthening on the other, and take it back and forth. Noticing what's maybe shifted or changed from the beginning, and then again the hip lift and hip dip from each side of the pelvis, rocking back and forth in those rotational movements. Again, noticing if maybe it's easier or is it the same as it was at the beginning. And then once we're complete with those, go ahead and lengthen yourself out, use your bolsters or whatever you need to for your relaxation. Maybe covering up with a blanket. So just give you a moment or two to get settled here. So today's practice mostly focused around the pelvis and the legs. So with this guided exploration of connection in the body, we'll connect our upper and lower bodies together. So imagine that you've got a golden pen, and you're going to start to draw a line around the outside of your body. So you're going to start off near the right waist and just start to bring the right, or that golden pen up towards your right armpit. Feel and sense that part of your body, and then bring the line down from the armpit to the right elbow. From the right elbow to the right wrist. From the right wrist around the baby finger, down to the webbing between the baby finger and the ring finger, up and around the ring finger, the other side between the middle and ring, up the middle finger, and down the inside towards the index finger, around the index finger, and then all the way down to the webbing of the thumb. Up and around your thumb to the right wrist by the thumb, and then up to the elbow, and all the way up to the top of the right shoulder. From the right shoulder to where the neck connects to the shoulder, and then up that right side of your neck, along the side of the head, around the right ear, reaching over the crown of the head, coming around to the top of the left ear. Around that left ear, down to the left side of your neck, to the top of the left shoulder, and then out to the point of that left shoulder. From the left shoulder down the outside edge of your arm to the elbow, and down the left forearm to the wrist. Around that left thumb to the webbing between the thumb and the hand, and then up along the side of the hand to the index finger, up and around the index finger to the webbing between the index finger and the third or middle finger. Up around that middle finger, all the way down to the webbing. I guess we don't have webbing, but that point of the ring finger, and then up around that ring finger to the base of it, and then around that baby finger. Down and around the outside of that baby finger on the left hand, along the left hand to the left wrist. Coming up along the inside edge of the left arm, the elbow, and from the elbow to the armpit. From the left armpit down the outside of the left ribs to the waist, and from the waist down the left side of the pelvis to the hip. From the left hip down the outer thigh to the left knee, and down your left outer shin to the left ankle. From the left ankle all the way down the side of the foot to the tip of the baby toe, and then going around each of your toes, so the fourth toe, the third toe, the second toe, and the big toe, and then down the inside edge of your foot, up towards the right ankle, from the right ankle, the left ankle to the left knee, and from the left knee all the way up to the part of the pubic bone where your left inner thigh connects. Across the pubic bone to the inner right thigh, and down that inner thigh to the right knee, down the right side of the lower leg to the inside of the right ankle, and around that right foot from the side of the foot all the way up to the tip of the big toe. Around that big toe to the second toe, the third toe, the fourth toe, and the baby toe. From the baby toe up the outside edge of the right foot, coming up to the right ankle, outside edge. Up the outer side of that right lower leg to the knee, and then from the knee to the hip on the right leg, and from the hip back up to the top of the pelvis at the waist where we started our drawing. Take those last few moments to notice if you can sense and feel all of those parts of your body. Notice if there's any parts that are kind of not quite as in connection with your mind or your sensory cortex. Sense and feel your breath moving within the container of the drawing you just made. Sense the breath expanding from the center of your being all the way out to touch the golden line surrounding your body. And again, noticing what areas that might be difficult to sense. Your practice here today, so you're welcome to continue to stay and rest in Shavasana for a few more minutes, or if you decide to get up and continue on with your day, please do so slowly. Have a wonderful rest of your day.